Okay, so you have a chart in your book about these 5 stages of high blood sugar.
Right.
So let's just have you talk through that a little bit and how that relates to people who are living with type 2 diabetes. And then we'll go on and we'll talk about how that would relate for people with type 1 diabetes.
Okay, so on page 90 of my book, Goodbye Diabetes, I have this chart of the 5 stages of hyperglycemia or high blood sugar. And this chart was first developed when I was working closely with Dr. Charles Brenniger, who was the leading diabetologist at Loma Linda University for decades. And he decided to come out to Guam for 3 years and spend 3 years on the island helping us research diabetes and put together an awesome diabetes center. And so we were asked to head up this task force for the governor to deal with diabetes on Guam. It was just out of control. It was just horrendous. And so I remember saying to Dr. Brenner, I says, how are we going to prevent diabetes on Guam when the current standards of testing don't even pick it up until you've already had complications for 5 to 10 years? Right? And so that's why we realized we had to come up with some earlier stages of hyperglycemia, of high blood sugars that happened before the diagnosis. And so by definition and by design, rather, the 3rd stage of high blood sugar is the beginning of prediabetes. In other words, there's 2 stages of high blood sugar that come even before prediabetes. Okay, and then there's another 2 stages that work up to the diagnosis of diabetes. Now that would be true to whether we're talking about type 1 or type 2, because it's just a diagnostic value. Clearly, though, we have different criteria for somebody who's diagnosed with type 2 diabetes versus type 1 diabetes in terms of how aggressive we want to be. We're not trying to get people down to optimal if they're type 1 diabetes in terms of that stage, because they could easily become hypoglycemic, and that would be far more dangerous than having a high blood sugar. In other words, what's more important than blood sugars in a type 1 diabetic or even a type 2 diabetic is what you're eating and what your lifestyle is. The programmatic aspect of what we choose to do is far more important than how high your blood sugars are. Now, I'm not discounting blood sugars. I'm just saying focus on the most important things. Follow the program and then get the benefits from the program, irrespective of the impact on blood sugars. And so on even a type 2 diabetic, Rowdy, what happens is that they may be on a lot of medicines. And so we have to, on day 1, help them working with their primary care physician or whoever is prescribing that medicine to get on a sliding scale so they can start adjusting that medicine day 1. So if I were to get the one cautionary note to all your listeners, the thousands of people right now listening to this, getting excited about, hey, man, maybe there is hope. Maybe I really can reverse this. Maybe if I'm a type 1 diabetic, I can prevent all those complications and optimize my blood sugars further. If I'm a type 2 diabetic, there's a really good chance I could reverse this if I know what I'm doing. But the number 1 risk is blood sugars dropping too fast because they hesitate to adjust their medications. And so I can't emphasize that enough. In our Diabetes Undone program, we say that in the beginning of every single class. You need to be checking your blood sugars before and after meals. And as soon as you start seeing a shift in the right direction, you need to be working with your doctor to cut back that medication. Because if you don't, you will end up in the ER and you may actually die. So you got to be on top of it. You got to know what your numbers are. And that's exciting. When people say, are you serious? Now they have a reason to check. Previously, they say, why should I check? Nothing changes. It's always bad. So they stopped checking. Now we have a reason to check because it's going to show you, it's going to demonstrate to you how powerful 100% plant-based diet is when you're adding in also after meal light activity, things like that just plummet those blood sugars.
So this is phenomenal because we see this all the time in our coaching program as well. In your experience, how quickly do people see a need to reduce their medication, whether it's oral medication or injectable insulin?
There's a lot of my colleagues that immediately cut medications in half on day 1, okay, and many times cut it out altogether if they're a part of program where monitoring is easily done. So if somebody is working, long distance through working with a coach or whatever, they just need to be checking their blood sugars and basically put their prescribing physician on notice. I am now in a program that will dramatically alter my blood sugar levels. I need to know how to adjust my medicines. You need to tell me that information. And my physician colleagues who are the first to admit, we are great at putting people on medications, but we're horrible at helping people come off, especially diabetes medications, because the concept out there is that, well, no, the expectation is that we're just going to have to keep increased medication dose, add more and more medications. That's expected. Of course it's expected. If you're not addressing the causes of the problem, then sure, we're going to need more medication. But if you address the causes, day one, you need to start making adjustments, but by checking. So that's why I always tell my patients for the first 2 days, don't change anything. Keep eating the same old, whatever diet you've been eating. Don't change anything. Just check your blood sugars before, 1 hour, and 2 hours after the beginning of the meal. Track that. Get numbers for everything, and just write out what you're eating. Then I tell them, don't even change anything about your diet. All you do is just add after meal exercise. I'm talking about just walking, just something light, and see the impact of after meal exercise. And we can talk about that later if you want. And then add the 100% plant-based diet or gradations of that if you're struggling. Okay, but they always need to know what's best, right? Then once they apply the best, they see this dramatic transformation in their blood sugars, and then they're sold. It's like, wow, I would have never believed this if I hadn't actually looked at the contrast between what my after meal blood sugars were on my normal diet and what they are now when I'm following this good, evidence-based, scientific, best medicine available today program.
This is awesome. Let's talk about this in a little more detail. So in the 5 stages of high blood glucose numbers are optimal. In the optimal range, you have somebody about an hour after they ate, 119 or less. I just want to talk about that a little bit, that you see people that this is real, this happens, people eat, these foods you're talking about, whether that's potatoes or beans or fruit, rice. They see those things and their blood glucose, a healthy person, is not going above 120. Correct?
Right. So if somebody is truly metabolically healthy, which let's be clear, very few Americans are metabolically healthy, very few. So, and this is in a nutshell. If you're between the ages of 40 and 59, 1 out of 2 of us already have at least prediabetes. That's at least stage 3, high blood sugars or higher. If you're between the ages of 60 and 74, it's 2 out of 3 of us. Okay, and if you're above age 75, it's 3 out of 4. So that's prediabetes, right? And so if prediabetes is the norm, just imagine what insulin resistance is. So my estimates are that anywhere between 80 and 90% of Americans are insulin resistant, okay, at some level. Okay, and we can measure that by looking at a glucose tolerance test, measuring insulin levels. Okay, and so the key here is understanding that if all we have to check is the blood sugar, the 1 hour blood sugar is the most sensitive. And so you can still be insulin resistant and have a perfect 1 hour blood sugar, but most Americans have a 1 hour blood sugar after they've consumed sugar that's way above 120. Okay, in fact, they have a perfect fasting sugar, a perfect 2 hour sugar, but the 1 hour sugar may be as high as 200. I see that all the time.
Got it. Okay, so now for people living with type 1 diabetes that adopt this lifestyle, what would you expect a good 1 hour blood glucose to be after having one of these meals?
Well, I think the key to focus on in a type 1 diabetic is to run the numbers like I suggested earlier, where you're actually checking your blood sugars after what you normally do, before a meal, 1 hour after the beginning of the meal, and then 2 hours after the beginning of the meal. And do that before and after every meal for a couple days so you get a pattern. You see what your pattern is. And then when you start adding in the light exercise after meals, when you start adding in the appropriate diet, you start adding in appropriate rest and all the other factors that come into a comprehensive lifestyle medicine approach, then you'll see how dramatic that changes. And a type 1 diabetic will typically have to cut their insulin down by 40 to 50% or more. I know that you're experts at that more than I am. You do it every day, right? So I should be asking you that question. But as you know, everybody's a little bit different. And the key is remembering that many type 2 many type 1 diabetics, not like yourselves, they actually have a form of type 2 on top of it. They're horribly insulin resistant. And if you're taking more than 30 units of insulin a day, that strongly suggests that you're insulin resistant in some way. It may not be because you're overweight. It may be because there's a low-grade infection. It may be because of stress. It may be because of other inflammatory markers going on. But so we need to ask the question, what are the things that are driving that insulin resistance, and how to combat that?
Can you go back to what you said? You said if you're using more than, I think it was 30 units of insulin per day, then
that's a rough estimate typically. And again, there's many factors that come into this, but we would normally say that a typical healthy individual, their pancreas needs to produce somewhere between 20 and 30 units of insulin a day, and it may be less than that. And so that correlation then goes to a type 1 diabetic. They're truly metabolically healthy. They don't have inflammatory problems or stress problems or other issues that are driving insulin resistance up. Then we're trying to limit the total amount of excess insulin required. Why? Because insulin is, as a growth factor, tends to promote many cancers and other potential problems. So it's only excess insulin that does that, by the way. It's not, I want to make that very clear. So I don't get demoralized if you're a type 1 diabetic and you're going, oh man, I'm really messed up now. I'm going to get cancer just because I'm injecting insulin. That's not what I'm saying. What I'm saying is that if I've had friends of mine, type 1 diabetics, that say, hey, they call themselves Dr. Dose, says, I know what to do. I'll get that mocha latte, to drink that down. And I just crank up my pump and give myself a whole bunch of more insulin. And then my blood sugars are okay, right? But at what cost? All that extra insulin is now potentially putting them at risk for things that they would have never dreamt about. And so they just need to know about that. And so that's why what you guys are doing and putting on this program and have this amazing cast of presenters, if even half of what is being presented is applied, we're dramatically altering not only the risk of the typical complications of diabetes, but the less known complications, cancer, other autoimmune diseases, and heart disease, and so forth.
I'm actually glad you hit on this link between excess insulin and cancer, because there's a lot of people in the type 1 diabetes community that will eat a low carbohydrate diet specifically to bring their total insulin use down to as close to zero as possible. And their methodology is, well, the less insulin I use, the lower my risk for cancer. Even though what you're saying here and what we also try and advocate is that there's a fundamental difference between your physiologically normal amount of insulin secretion versus an excess insulin use. So I'm really glad to hear you say that it's the excess insulin use that's increasing your risk for cancer and other related diseases, and it's not your physiologically normal amount of insulin that's actually causing that problem.
Yeah, absolutely. And to take off on that point specifically, we know, for instance, that one of the main complications of diabetes, of high blood sugars, is advancing chronic kidney disease. And so the individuals that buy into this logic of bringing in more meat products as a way to, in their thinking, optimize the diet, to optimize insulin resistance in their thinking, they're actually dramatically increasing other risk factors, and the risk-benefit ratio is going way the wrong direction when they do that. We know there's no question, there's no argument that one of the number one contributors to progressing chronic kidney disease and to end-stage renal failure is meat of any kind. white meat, red meat, any kind of meat dramatically increases risk of progression by like 300% or more. Okay, and so what's the whole point of controlling blood sugars if now you're actually leading to end-stage chronic kidney disease, which increases your risk of Alzheimer's 500%, increases your risk of a heart attack between 300 and 500%. I mean, let's focus on things that are logical and make sense. And so going with the meat protein, horrible idea, even based on the current research.